Hello everyone and welcome again to another case in the series of emergency medicine. Today we will be talking about how to manage acute pyelonephritis, the infection of the kidneys and their management in ER. So as I told you earlier in my previous lectures that I would not be going into detail about the risk factor, the causes. I would just be going into acute managements as one day you will be working in emergency medicine so you can confidently manage such patients. So let us start the case. We have an adult who presented with sudden onset flank pain. He had sudden onset flank pain, and with it the patient also had fever, burning micturition, dysuria, suprapubic pain, nausea, vomiting. So the patient presented with such features. If the patient is not acutely managed, it can lead to shock. So here we'll be talking about the patient without shock because we just want to manage acute pyelonephritis. So we will manage our ABCDs. We will manage the airway. We'll manage the B for breathing, and then our next task will be managing the circulation. So in circulation, we need to pass an IV cannula, monitor vitals, and send the labs as we have the patient in ER. So most important part is giving the fluids because we want to give the fluids so to flush out the urinary tract system. And the patient had pain because the patient will have pain, so we need to manage it with ketorolac or tramadol. And for the spasm, the same dotravine can be given. And for vomiting, injection oncetrons 8 mg diluted in 50 to 100 ml can be given. Now the main part is giving the antibiotic coverage. For antibiotic coverage, we need to give injection ceftriaxone 1 gram IV BD or 2 gram IV OD depending on the severity, because once we can also do the culture depending on the patient sensitivity to certain antibiotics, and or we can also give injection cefepime 1 gram IV BID. So this antibiotic coverage can mostly cover up the gram negative infections of kidney. So once the patient antibiotics have been given, we can also for the fever we need to give the paracetamol 1 gram IV TDS. For stress ulcer, because most of the patients are in stress, we can give as a prophylactically omeprazole for AMG IV OD. Any PPI can be used. So once the patient has been stabilized, diagnosed, and we need to correct the underlying cause, what caused that infection. And please remember that IV antibiotics are first used for 48 to 32 hours, followed by 7 days of oral therapy if the patient is not in the shock. Yes, radiology can be done, ultrasound QUB, CT QUB has been done to know the exact cause. So this was a short video about how to manage acute pyelonephritis. Please like and subscribe my channel and comment on my channel how can I improve and which lectures, which topics you want next, so I can make it for you. Thank you for watching.